we have a problem with this muscle that a big part of the muscle is below the scapula, so you cannot approach it. The good thing is that you have a very good amount of muscle just over the rib. So it's
립을 덮고
serratus anterior
세라투스 안테리오.
is... Do you have pain in the shoulder? Did you had an accident, a subluxation in the shoulder? Do you feel okay or some pain?
괜찮-
It's a lot of trembling in the arm. That you have a trembling
이렇게
or
하면
it's your
더
first
뚫는 걸
time
알고
in your life?
있었어요. He already.
He knows.
예,
Only on this arm or on the other? How much coffee does he drink during the day?
just one a day.
Okay, interesting. Good. But you feel okay?
Interesting.
Yeah? Good. Now, so serratus anterior, you just palpate over the rib, easy.
예.
So if you like to see a little bit more of serratus, can you press the bed? Come
베드를
here to see. Press, 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 press. If
Bed-
you are pressing, you can see the teeth of serratus. Yeah? He's good. He's really well trained. Yeah? Can you see? And you can see the tooth is still the middle of the rib, and then you have abdominal externus oblique. It's the next muscle. So it's the next muscle covering the rib. Where serratus ends, you have the abdominal externus oblique over the rib. And you can see that on him, they are really strong. Really strong.
진짜
Release. Good. So what you are doing is you go over the bone, the rib, and the rib has a direction from back and up to front and down. And you go perpendicular to the rib to see if you can reproduce the rib pain of the patient by your palpation. Pain?
앞으로
Apa?
아파?
Napa. Anapa.
안 아파?
Anapa.
안 아파.
Which muscle is this? You can see I'm going to serratus, but serratus, I cannot, let's say, go further back because it's a muscle. Which muscle is this? It's latissimus. So you have a problem because a big part of the muscle, it's latissimus and then the scapula bone. So you cannot palpate. So we must find a way to palpate. Good. So that's easy if you like to palpate. Now, one trick you can do is to ask to have a little bit of scapula retraction by bringing the arm back. So to have more space to bring latissimus back and scapula back to have more range of palpation. That's one trick you can use. Sometimes we don't palpate here. Come around and
안
see.
보세요. 그럼 발베이션
This
쉬운
is
방법.
serratus. And sometimes it's twitching here on him.
로컬 트위치.
Yeah,
로컬 트위치.
he made some, but now.
로컬 트위치.
So here it's serratus. No problem. I feel the rib bone. It's not dangerous. So we need to bring the arm back in order to have more palpation space. Yeah? So that's the one trick I do to have more possibilities for serratus. Now, if I have the rib pain on this place, I go from the rib between the ribs for the intercostals and try to find the direction. Now, for him, I cannot have a lot of space. Can I have a big towel, please? So if you don't a lot of palpation space and it's allowed and don't have other problems, normally I'm using a towel. If it's not a lot, I can use a foam roller like the ones we have here. Good. To give more space between the ribs, to be more between the ribs, to have more fibers in my hand. Yeah, and I have some soft foam roll. It's not like this because this is painful. If you put it, it's painful.
저건 안 좋답니다.
인터코스탈 무시하는 거예요?
그렇지. 네.
Intercostal.
지금 시초하네.
Yeah. Now,
저거는 너무 딱딱해서 아플 수 있으니까 맞추면.
if you need to go more forward in intercostals, because you have intercostals here, you can have a little bit more extension to open the space. If you like to go more backwards on intercostals, because you have here also intercostals, you give more flexion to open the space. So you must play with the ribs because they are really close, and you must find ways to have a little bit more space between them. Now, if you go to a lot of flexion, you might have latissimus very tight, so I will bring the arm down to release a little bit the latissimus.
저렇게
So
되면
you must play around a little bit. And you must go deep between the fibers. Good. And you have a lot of rib space. Yeah? Now, we have a problem to solve. That's easy. That's superficial. That's below the skin. Nobody has problems on this. The problem is how to find fibers of serratus that are below latissimus dorsi. So here I changed my strategy and changed my position. Sorry about this.
라티스모
And normally, what I'm doing is that here I have serratus over the ribs.
세라투스.
I'm bringing the scapula in retraction, so I have more centimeters of palpation. And then I'm going below latissimus and search as deep as I can. So I'm giving retraction and I'm going back and I'm going back and I'm trying to be below latissimus. Now, sometimes it's really stiff to go below latissimus, and I do a technique 4 to open the space for palpation. Will give me more space to go below the muscle. So then I will try again. If I open some space, I have now more space to go back. And you see that I'm going more far. Fingers are disappearing. So he let me go more in. So I can use this technique 4. It's good for the range of the shoulder also. We are going to discuss later. But it's very nice to give me more palpation space. So we have palpated, let's say, on the rib. We have palpated below latissimus and to the lateral border of the scapula, but we must palpate the fibers inside of the scapula and below the scapula. So what you can do here, some people do this, go below the scapula. It's not, I use it very often. You can use it, but not very often. The reason is that this movement is the first movement you are missing in a shoulder pain patient. They cannot do this. So I normally have the arm to the side to not have pain in the shoulder, a little bit more close. And now the muscle is below the scapula, okay? It's the emerging point. So I'm taking some protraction. I prepare my hands on the medial border, and then passively I go, relax, relax. No, I will do it. Not, you don't do it. It's lit to me. Good. I go to retraction. So then I'm searching on the back of the scapula, the fibers. And this you can do also as a technique 4, if you like to increase the gliding of the scapula to the ribcage. Now, for him, it's not very easy because he's contracting. So for these people like him, I have an alternative solution. So here, it's easy because he's more passive now. Are you okay with? So here, he cannot activate a lot, and I can search easier. For people overactivating the muscle during palpation and go even more. Or you can play around a little bit with the rotation. But for him, I don't like him to move because he's fixating. I like to do most of the things. I can be on from the other side. Good.
오.
Good. It's a new scapula. Nice. So, repetition. What we should do? So, first, ask the person to press down. Find serratus and work over the ribs. If you like to go more back, ask the person to bring the arm back and find more space to work on the ribs. And of course, work between the ribs for the intercostals. That's normal. Second, take the arm from side and start pushing the arm back to have scapula retraction. Good. And try to be deeper below serratus to find fibers hidden below, latissimus. And if latissimus is stiff and you don't have the space, start with a technique 4, and then it will give you more space to go back. Okay, that's second. Third, come closer. You must go to the inside of the scapula, a little bit closer. If the person has a shoulder like this, it's okay. You can go retraction, protraction and then retraction and search. Most of the patients cannot do that. So you must have the arm to the sides. So first, protraction, retraction, and go back. If for a reason it's difficult to do,